Hello everyone, we are the Biomedical Science Students Association. Today's video will cover the topic of the COVID-19 pandemic and how to protect yourself during these turbulent times. Firstly, what is COVID-19? COVID-19, more commonly known as the coronavirus, is the latest cause of a global pandemic that is wreaking havoc on countries across the world. 2019's coronavirus actually belongs to a family of coronaviruses, which are characterized by viruses that have crown-like spikes on their surface. Anyone can be infected by this virus, whether they are a senior, a child, or a healthy adult. Individuals who are over 40, have weakened immune systems, heart disease, lung disease, or diabetes have a higher chance of getting seriously ill. Those who are afflicted by COVID-19 often have symptoms such as fever, cough, nausea or vomiting, shortness of breath or difficulty breathing, and headaches, among many other symptoms. However, some people with COVID-19 are asymptomatic, which means they have few or no symptoms at all. How does COVID-19 spread? COVID-19 spreads quickly, primarily from person to person through respiratory droplets. These respiratory droplets can come from a sneeze, a cough, or even just through talking. Any person-to-person contact closer than 6 feet apart increases the likelihood of contracting COVID-19. There are two primary ways the virus can be contracted: direct contact, such as eating, drinking, or touching anything with the virus on it, and inhaling droplets that contain the virus. That's why it is always a good idea to follow the safety guidelines the CDC provided, as they help to reduce the amount of infections and prevent more deaths from occurring. These safety guidelines include avoiding close contact to people who have tested positive for COVID-19, washing your hands often with soap and warm water for at least 20 seconds, especially after going to the restroom. Maintaining good hygiene is very important. Never touch your eyes, nose, and mouth with unwashed hands. Also, if soap and water are not readily available, you can use an alcohol-based hand sanitizer that contains at least 60% alcohol. Clean and disinfect frequently touched objects and surfaces using a regular household cleaning spray or wipe. The virus can stay on surfaces for a while, so taking the time to disinfect only does more good. Stay home when you are sick or if you have traveled recently. Spreading the virus, whether you know if you have the virus or not, creates more cases and will not solve the situation any quicker. If you have to go out, practice social distancing, keeping 6 feet between you and the people around you. Avoid crowded places and don't go out for vacations. Most importantly, wear a mask when going outside. Now, you may be wondering why wearing masks is a must, as it is uncomfortable to talk, breathe, or do anything while wearing it. How does a mask help? Masks are really important because they are used to protect other people from your respiratory droplets. Remember that there is a chance that you've contracted the virus even if you don't show any symptoms. In turn, people who wear masks will protect you from their respiratory droplets. Masks with holes like these will not help, since your respiratory droplets can get through the masks very easily. Masks that cover your nose and mouth completely, like these, will make it harder for your respiratory droplets to come in contact with the person you are talking with, and therefore are more effective. In the following 2 tutorials, we will teach you how to make homemade masks, according to the CDC guidelines linked in our description. Only make these masks when you cannot buy professionally made masks.
Here are some of the materials that you will need: a sewing machine, fabric, it should be cotton fabric, a flat surface, scissors, thread, ruler, elastic bands, and an iron, and maybe some head pins. First, cut the fabric 9 by 12 inches, and then cut the elastic bands 6.5 inches, and you need to make 2 of these. And now we have to fold the fabric so that the 9-inch sides touch each other. So you have to fold it like this so that the pretty part is on the inside. Next, we have to secure these inside the fabric. So like this, preferably with head pins. And then you have to sew around except for the middle part here. Now we're going to make some pleats, which are basically folds. And the easiest way to do this is to first split both sides into 4 sections with these pins. The pins are there to help you know how to fold. So you fold it like this. After you fold it, try to secure it by pinning the fold. And now sew around the mask. And now the last step is to just open it up and put it on.
For a hand-sewn mask, you will need 2 layers of cotton fabric, scissors, a needle and thread, elastic, a ruler, and some sewing pins. First, using your ruler, measure and cut out a 9 by 6 inch rectangle from 2 layers of your fabric. Separate the layers and stack them so that the pattern side is on the inside. Sew around the 9-inch edges of the rectangle using any basic stitch as long as it's secure. Then we're going to flip the fabric inside out. Now you want to close the 6-inch ends to create a tunnel on either side of the mask by folding the fabric over to hide any fraying. Once that's stitched, cut 2 9-inch strips of elastic. We're going to feed these through the tunnels in the mask using a safety pin. From here, just stitch or tie your elastic, shift the band so that the seams aren't showing, and scrunch the sides of the mask to better fit your face. Stay safe, everyone!
No mask is foolproof, but they do help significantly with lowering your chance of getting infected and increasing the chance for this pandemic to end faster. Thanks for watching.